All right, let's jump right in. Today, we're looking at something that has become incredibly common, PCOD and PCOS. But we're going to look at it through a really different, really ancient lens, the perspective of Ayurveda. And just to get a sense of why this is such a big deal, look at this number. According to our sources, nearly 1 in 5 women in India is affected by PCOD or PCOS. Think about that for a second. That's not a small niche issue. That's a massive, widespread health concern for millions of people. Okay, so first things first, let's clear something up. Because these two terms get thrown around a lot, they are not the same thing. PCOD is a condition where the ovaries are a bit dysfunctional, releasing immature eggs that can turn into cysts. It's often less severe. PCOS, though, is a whole different ballgame. It's a full-blown endocrine disorder. It messes with your metabolism, your hormones. It's a much more systemic and serious issue. So here's how we're going to break it all down. We've just touched on how widespread this is. Next, we'll get into the really interesting part, how Ayurveda sees the root cause. Then we'll walk through the treatment plan, look at a real-world case study to see the results, and finish up on the core philosophy behind it all. So how does a system of medicine that's thousands of years old even begin to explain what we think of as a modern condition? Well, Ayurveda doesn't see it as a disease of the ovaries. It sees it as a breakdown in the body's entire system of balance. And to get that, you have to understand doshas. It's a core concept. Think of them as the 3 fundamental energies that run everything in your body. You've got vata, which is all about movement, pitta, which handles your metabolism and digestion, and kapha, which gives your body structure and stability. When you're healthy, these 3 are playing nicely together in perfect balance. Now here's the connection. According to the Ayurvedic texts, PCOD and PCOS are symptoms of a deeper problem. Specifically, the kapha and vata doshas getting seriously out of whack. It's not just a hormonal problem, it's an energy problem. And this is how it happens. It's like a domino effect. It starts with things like poor diet and lifestyle, which cause that heavy kapha energy to build up. This excess kapha literally starts to clog up the body's internal channels. And when things are clogged, what happens? Vata, the energy of movement, can't flow properly. That disruption is the final domino, and it's what eventually shows up as hormonal chaos, cysts, and all the other symptoms we associate with PCOD and PCOS. So, if that's the diagnosis, a multi-step chain reaction of imbalance, what's the cure? Well, it follows that the solution can't just be one single thing. It has to be a multifaceted plan designed to restore harmony at every level. Step 1 is always diet. The main goal here is to reduce that heavy channel-blocking kapha. So you're looking at light, easy-to-digest foods. Think millets, fresh veggies, things like that. And just as important is what you avoid. You got to cut out the things that create more kapha, like dairy, sugar, junk food, and even cold drinks, which are believed to put out your digestive fire. Then you bring in the herbal heavy hitters. Think of these as a specialized toolkit. You've got ashwagandha to tackle stress, which we know messes with hormones. Shatavari is a classic for reproductive health. Triphala helps with detox. Guduchi can target insulin resistance. Each one has a very specific job to do in rebalancing the system. And then we have panchakarma. This is the deep clean, a total system reset. It's a really methodical process. It starts with preparing the body with things like herbal massages, then using medicated ghee to actually go in and bind to toxins. Only after that do the main cleansing therapies begin, which are designed to physically expel those blockages and get the excess doshas out of your system for good. Okay, so that all sounds pretty intense, but the real question is, does it actually work? Let's move from theory to practice and check out a documented case study to see what kind of results we're talking about. This quote really sets the scene. It's from a paper published in a US government medical database, and it makes a pretty huge claim. Complete relief from PCOS symptoms within just 2 months. That's a bold statement. So let's see the data that backs it up. And wow, these numbers are pretty incredible. Look at this. The patient's weight dropped, bringing her BMI from the overweight category right down into the normal range. That's fantastic. But this right here is the real showstopper, the ultrasound. Before, her left ovaries showed clear signs of PCOD. After just 2 months, normal. Completely normal. Even her thyroid function improved. These aren't subjective feelings. These are hard, measurable results. And that case study really brings us to the core philosophy, the big idea behind this whole approach, because the goal was never just to get rid of the cysts or just to lose some weight. This is the key takeaway. The entire plan, the food, the herbs, the detox, it's all aimed at one thing, fixing the root cause, that dosha imbalance. The Ayurvedic thinking is that if you can restore the body's natural state of harmony, the symptoms just disappear because you've taken away the reason they existed in the first place. It's a total shift from managing symptoms to actually restoring health. Which leaves us with a really fascinating question to chew on. As we search for answers to these complex modern lifestyle conditions, could it be that a big part of the solution is found not in looking forward, but in looking back, in rediscovering the holistic root cause wisdom of these ancient systems? It's definitely some food for thought. Thanks for joining me.